Yes, I gave that presentation earlier this morning. Elritercept is a modified activin receptor type 2A ligand trap, and what it does is it helps to regulate the TGF-beta signaling pathway, and by doing that it can help to restore hematopoiesis. In myelodysplastic syndromes, anemia is one of the main cytopenias that affects patients, and patients who are heavily transfusion dependent have a poor quality of life related to that. So achieving transfusion independence is very important for our patients. So using Elritercept in these low-risk myelodysplasia patients, quite a number of the patients had high transfusion burden, defined as 4 units or more in the preceding 8 weeks prior to treatment. And despite that, we saw a transfusion independence rate of 8 weeks or more within the first 6 months or the first 24 weeks in about 39% of our patients. And when we focus on the erythropoietin level of less than 500, which is what most of the low-risk MDS trials focus on, we see an improvement in the response rate or the TI rate up to by another 10%. And interestingly, because we could look at the high transfusion burden patients, because they were the majority of patients who enrolled on study, the effects of the transfusion independence was maintained. We also looked at the total hematological improvement in the erythroid response, called the HIE, and that also includes low transfusion burden, high transfusion burden, and non-transfusion dependent patients, and the response rates were seen at 49%, and again this was seen to be consistent, if not a bit higher, in the difficult to treat population of non-ring sideroblast patients as well as high transfusion burden patients. The other exploratory analysis that we looked at was looking at platelet and neutrophil improvement, and these were also seen in the majority of patients. So all in all, Elritercept is a good agent to have and is being investigated in a phase 3 randomized control trial in transfusion-dependent lower-risk myelodysplasia, and we will await those results.